Welcome. This is actually a session that's geared towards familiarizing the candidates towards residency interview. My name is Zeenat Qureshi. I'm Professor of Neurology, Neurosurgery and Radiology at the University of Minnesota. I've been involved in residency interviews and fellowship selection interviews for several years. And what I'm going to tell you initially is just give you a brief introduction, which will be followed by actually talking to the candidates who have been through the interview process. There is no right or wrong answer to many questions, but in fact, what you require is a certain level of comfort and perhaps clarity in answering some of those questions. First of all, I want to introduce you the process of residency selection and to put interview process in its proper perspective. Whenever candidates are selected, there are three different parameters with equal weight that is being used to make that selection process. What were the candidates' USMLE scores? That's a hard and fast criteria. There is no room for interpretation. Essentially, your score is what it is. The letters of recommendation. There may be variation in how people grade performance. And everybody understands that several different observers may look at the same performance and give you a different letter of recommendation. So perhaps there is some variation in the letters of recommendation and the strength of these letters. And the third one is your performance in the interview. So in reality, in the selection process, it only forms 1/3 of the parameters that are used to make a selection or make the residency selection. Now, many times people worry about giving the right answer to the question, but perhaps for many questions that are asked in the residency process, there is no right or wrong answer. In fact, the interviewer is really trying to see the method with which you answer the question, not necessarily the answer to the question. What I recommend is to consider it 5 C's. So each answer is graded on 5 parameters, what we call as 5 C's. Whenever a question is asked, what is your ability to comprehend the question? If an interviewer is asking you a question, are you really answering the question that he's asking, or you're answering some different question and you have not been able to comprehend properly what the exact question was? And usually most people would easily succeed in this parameter. The next parameter, the next C, is clarity. When you answer, are you able to articulate yourself in a manner that's clear? Are you able to convey your message across the table in an effective manner? And that's clarity. And it doesn't matter what the content of your answer is. More important is whatever you're trying to say can be understood by the person across the table. The third one is contiguity. Is there an organization in your thought process? You may say 5 sentences, but are they organized? Are they in a sequence? Or they're being randomly placed in your answer? And this is really about organizing your thought process. So it doesn't matter what your thought process is, but there has to be a certain level of organization in your thought process. Then is consistency. And usually when multiple questions are asked of you, is each of this answer really reflecting the same theme, or in fact you're conflicting or contradicting yourself in different answers? So I think that's an important message, that whatever is reflected in your scores, whatever is reflected in your letters of recommendation, in your personal statement, the answers in your interview must be consistent with the theme that is reflected in the earlier documents and perhaps in your earlier answers as well. The last part is competency, and most interviews are not geared towards identifying competence. But if somebody is trying to ascertain your competence, that probably is a positive point, where they have already accepted that you've done very well on the first 4 C's, and in fact it is time to take it to the next level, which is to assess your competence, whether that is in relation to medical knowledge, whether it relates to research experience, or whether it relates to both. I think that is something that usually is an advanced level of ascertainment, and that is called competence. And you may actually be posed questions that are directly related to the field that you may not have even entered at this point. So I think this is one way of looking at the interview process, putting the right perspective, the right weight on where interviews stand in the residency selection process, and perhaps not focusing always on what is the right answer, but how you answer the question.